Crisp provides services to physicians, nurses, care managers, and staff to increase their ability to provide optimal patient care. We implement services incrementally, first through pilots, and then expansion of data and features over time. Our pragmatic approach requires an understanding of how users experience Crisp within the context of their daily routines. We reached out to a handful of users to better understand how they incorporate Crisp services into their workflow to improve patient care and outcomes.
We use the query portal many times a shift. In any given shift, I'll see between 15 and 30 patients, and I'm accessing it multiple times during the course of that shift. Most commonly, when I access the query portal, I'm looking at a couple things. I'm looking at their recent blood work that they've had, either at the hospital or at an outpatient laboratory center. I'm looking at their recent imaging. I'm looking at how things may have changed over the course of prior imaging as well. I'm also accessing discharge summaries from other facilities, so I can see what's been completed recently for those patients that may not have a lot of insight into what's occurred, or those patients that are unresponsive. It has helped with not having to contact other facilities in order to get records. It's helped us to notify primary care physicians as well as to their recent stay. Here in our emergency department, we have some patients that are frequent utilizers that need additional assistance, whether that's with identifying a medical home or social determinants. These patients, we meet with the health department and other stakeholders to try and develop care plans. CRISP has now given us the opportunity to store some of those care plans. And these are patients that present to multiple surrounding emergency departments. So in order to take advantage of those services that already exist for the patient and to prevent any redundancy in developing plans for them, we can access the tools on CRISP to see what's already been developed. CRISP provides the perfect storage place for care plans to provide continuity of care as patients present to different emergency departments or hospitals throughout the state of Maryland.
PDMP is really a game changer because it now allows us to see what the pharmacists have, what medications they have filled for patients. You know, the language and the name of the medications, this is all very complex information to patients who may not see this on a daily basis. So for us to be able to access this information and for patients who may not recall the names of the medications and those types of things really gives us the information we need to be able to make safer decisions for patients.
I use the PDMP portion of it, the prescription drug monitoring piece. That is part of my daily practice. My staff actually uses it on the regular. We utilize it whenever we receive an opioid prescription from any outside of Hopkins provider. Incorporated into our workflow, they will utilize CRISP to check where the patient has received opioids last. Based on the information they receive, they assess whether it will be appropriate for us to fill it. We also then contact prescribers and have discussions should we feel that there is some alert or something that we need to speak to them about. It is the obligation of everybody, every state, every organization to utilize every resource out there to safely dispense and prescribe on the other end.